Hello, a warm welcome to the programme. The UK Prime Minister Boris Johnson has left intensive care after positive steps in his treatment for coronavirus. In a statement, Downing Street said that the Prime Minister has been moved this evening back to the ward where he will receive close monitoring during the early phase of his recovery. They add that he is in extremely good spirits. Well, for the latest, the Prime Minister's condition, here's our correspondent Keith Doyle.
Well, the positive news from St Thomas's Hospital here in the centre of London is that the Prime Minister has now been moved out of the intensive care unit and has been moved back onto the wards. After 4 nights in the hospital and 3 nights in the intensive care unit, he has now been moved back onto the wards. A statement from Downing Street said earlier this evening that the Prime Minister has been moved this evening from intensive care back to the ward where he will receive close monitoring during the early phase of his recovery. And the spokesperson went on to say that the Prime Minister is in extremely good spirits. Now, he was brought to this hospital last Sunday after suffering the effects of coronavirus for 10 days. Then there was great shock when the announcement came that he was being brought into the intensive care unit on Monday. Of course, in the run-up to that, we had seen pictures of the Prime Minister on the steps in Downing Street, really not looking well at all. And then he posted a selfie video where he really, to any observers, he really looked like he was really suffering from the effects of coronavirus. So in intensive care for 3 nights. The statement that has come again from tonight, from Downing Street tonight, is the Prime Minister has been moved this evening from intensive care back into the ward where he will receive close monitoring during the early phase of his recovery. Of course, the key words in there, recovery and early phase. So recovery, he's on the road to recovery, things going in the right direction. But that phrase also, that this is the early phase of his recovery. So clearly some way to go before he makes a full recovery. Some reaction has come from Washington, from the White House. President Trump has said great news that Boris Johnson is out of intensive care. And he ended his tweet by saying, "Get well, Boris."
Well, thanks to Keith Doyle there outside St Thomas's Hospital in central London, where the Prime Minister has now been moved out of intensive care. So that's the latest on the condition of Boris Johnson. Let's bring you up to date with the latest figures for the UK when it comes to coronavirus, because they show that the number of confirmed cases stands at just over 60,000. There were 881 deaths reported over the past 24 hours. This is the 3rd day in a row with such high numbers. On Tuesday, there were nearly 800 deaths. On Wednesday, 938 people died, the highest daily total so far. This pushes the cumulative total of people dying from the virus above 7,000. Well, while the latest mortality numbers for the UK continue to shock, there were signs in Thursday's figures that the virus may be coming under control. Here's Fergus Walsh.
It's clear now that social distancing is working and virus transmission in the UK is slowing. Now, everything we're doing, shutting businesses, staying at home, is geared towards ensuring that the NHS, and particularly intensive care, remains within capacity. Now, if we look at the number of patients in critical care in the UK, it has gone up by 5% in the past 24 hours. But crucially, there are signs that it may be flattening. It's certainly not taking off. Now, you can see that London is by far worst affected. Now, intensive care units in the capital are busy and getting busier, but there is still overall capacity. Now, that is completely dependent on people staying at home. Now, if we then move on and look at the global death comparison, you can see that the UK is roughly on the same trajectory as Italy and France. Now, sadly, that means many more days of high death tolls. Germany's outbreak, which started later and is never really taken off. Now, part of that is down to them doing much more testing. Now, we're coming up to this bank holiday weekend, but it is crucial that people take home this social distancing measure, because eventually it will translate into a lower death toll in weeks to come.
Now, I want to turn to the United States now because there has been another massive increase in unemployment there. In just the past week, more than 6.5 million new claims have been made. This is the sharpest ever rise in unemployment, and this takes the number of jobs lost over the past 3 weeks to more than 15 million. Economists believe that the number could in fact reach 20 million by the end of April, as the country has in effect closed for business. Well, restrictions have put some 95% of Americans on some form of lockdown. Here's Samira Hussain.
If you add up the last 3 weeks, well, now we're seeing that it's probably more like 16.6 million Americans have lost their jobs. And economists are now predicting that for the entire month of April, we're probably going to see at least 20 million Americans lose their jobs. I mean, as we're seeing in Europe, the same situation here in the United States. It is unprecedented. It is something that these economies have never dealt with before. And you're seeing a lot of sort of different actors in the U.S. economy trying to address the immediate needs, which is why you're seeing the U.S. Federal Reserve, America's central bank, pumping in another $2.3 trillion into the American economy. They're getting into businesses that they never have before. So they're buying up riskier debt. And they're also offering more money as loans to medium-sized businesses to try and shore up what is happening here in the economy.
So that is the situation with the economy. When it comes to the death toll in the United States, well, there's also a lot of concern. The number of people who have now died from coronavirus has surpassed 15,000 in the States, and this is the highest number globally. More than 360,000 people are infected across America. So is the US close to hitting its peak? Well, I put that question to Catty Kay, who's in Washington.
Well, it's going to be at different stages, right? Because this is such a big country with so many states that went into lockdowns at different times that each of those states could hit a peak at a different moment. I'm here in Washington, D.C., and there's a big debate about when we're going to hit the peak. One of these COVID forecasting models says that Washington actually already hit the peak back at the beginning of April. Another forecasting model says that we won't hit the peak until July. So that just gives you some sense of the differences that are coming out of all of the different models and the data that people are looking at, which is why we're getting constantly these different assessments of how many deaths there are going to be in the US in total. We'd been told perhaps between 100 and 200,000. Now it looks more like 60,000, and that's just because the universities that are studying this are getting more data from around the world.
Well, Catty, let's just have a look at that in a little bit more detail. Don't go away, because I want to just analyse that a little bit more. So, as Catty was mentioning, the health official who is leading the US scientific response to coronavirus, Dr. Anthony Fauci, has revised down the number of people that he predicts could die from coronavirus. In an interview with NBC, Dr. Fauci said that the death toll looks more like the 60,000 than the 100 to 200,000 fatalities that he initially predicted, as Catty there mentioned. Now, he added the real data are telling us it is highly likely that we are having a definite positive effect by the mitigation things that we're doing, this physical separation. So, Catty, does that mean that this social distancing and the lockdowns that we're seeing across the United States, are they in fact working?
Yeah, I mean, that's what Dr. Fauci said in that interview, that this is all because social distancing is working. And those original numbers that we'd been given of up to 200,000 Americans dying, we're told, are based on most people not doing social distancing. Now, in fact, in the United States, all but 8 states have mandatory social distancing lockdown orders in place. So millions of Americans are staying at home. And that's why we're seeing these revisions downward, because the virus just doesn't have the chance to spread from people as much as it was doing so. I did speak to a former Trump administration official just this week, though, who cautioned that we could see the second wave of this virus as early as June. He didn't think it's going to come in September, October. He thinks it could come over the summer. And I think what all of the health officials are very keen to stress is the numbers are coming down because we are social distancing. If we relax the social distancing, then the numbers of deaths could start to rise again. The problem for health officials and for the White House is that, of course, psychologically, once people are told, well, the numbers are coming down, it's actually only going to be 60,000. We thought it might be 200,000. Perhaps I don't need to stay home so much. Perhaps this isn't as serious as we thought it was going to be. And that's what health officials are very worried about now, that people will get the kind of wrong message from the revision of these numbers.
The Italian Prime Minister has called the virus pandemic the biggest ever test for the European Union. Giuseppe Conte warned that the bloc could fail if it didn't take decisive action to help member states hit by COVID-19. Here he is speaking to our correspondent in Rome, Mark Lowen.
This is a big appointment with history and we cannot miss it. Myself and other European leaders need to rise to the challenge. And there's no doubt that if our response isn't strong and unified, if Europe fails to come up with a monetary and financial policy adequate for the biggest challenge since the Second World War, for sure, not only Italians, but European citizens will be deeply disappointed.
Well, Mr. Conte also told Mark that Italy may start relaxing its virus lockdown at the end of April. Now, Italy has, of course, been under a nationwide lockdown for a month. Let's hear what he had to say.
Experts are confirming that the curve is starting to decline and stabilize. The number of infections is decreasing. We're confident that if we continue this way, we will overcome the worst phase. But we cannot lower our guard. We cannot go from a lockdown to liberalizing all economic activity. We need to do it gradually.
When will the easing of restrictions begin?
It's likely that if scientists confirm it, we might begin to relax some measures already by the end of this month.
Giuseppe Conte there speaking to Mark Lowen. Well, Italy is pushing for a coordinated economic response from Europe, but there have been disagreements over whether the EU countries should jointly issue bonds, which would see them agreeing to share debts over coronavirus. The idea has been supported by countries like France, Italy and Spain, but it's been opposed by countries including Germany, the Netherlands and Austria. And Italy has also been somewhat angered by comments which were made in the German newspaper Die Welt, which said that the countries of the European Union should certainly help each other in the coronavirus crisis. But the paper asks, what? No limits without any control? It adds, in Italy, the mafia is just waiting for a new rain of money from Brussels. Well, for more on Italy's response to that, here's Mark Lowen again.
The Italian government is absolutely up in arms at that headline and has called on the German government to distance itself from that newspaper headline. I think there's a feeling that the EU has got its messaging wrong towards Italy during this crisis. A survey that came out last month showed that scepticism towards the European Union had risen from 47% to 67% here in the space of a month. There is a feeling that this kind of wrangling that's going on between Eurozone finance ministers is not doing anything for the image of the European Union here in Italy, which is, of course, one of the founding members of the European Union.
Well, EU finance ministers have in fact been meeting again to discuss further support for economies which have been hit by COVID-19 after those previous negotiations collapsed. And here's the chairman of the Eurogroup meeting.
Every day we are reminded that this virus is blind to our flags, to gender, to color or social class. There are no first-class passengers. We either sink or swim together. This is a true emergency.
It's not the opinion of some. The Netherlands were the biggest opponent of an EU-wide fund proposed after 16 hours of negotiations. But in the last few hours, the Dutch Prime Minister Mark Rutte sounded more positive about reaching a compromise.
We're trying to do the maximum to help bring the negotiations to a successful conclusion. But even if we succeed now, that doesn't mean the European discussion of the economic effects of this crisis is over. There has to be more done later.
Do you think there'll be a deal today?
Yes, I think that's possible.
So for more on why the EU is struggling to agree a recovery package, here's our Europe correspondent Gavin Lee reporting from Brussels.
The Italians, certainly in the meetings with foreign and finance ministers in the past few days in Brussels, are seen to be giving some ground when it comes to acknowledging the fact that if you borrow big sums of money, every one of those 27 governments have to acknowledge to some degree, I think that the message is being made, they will have to pay it back. It's just what conditions are attached. When will you have to pay it back? What interest rates? Italy have a much worse interest rate, for example, than Germany. Italy has been bailed out. Spain has too. Those are the wounds that they're dealing with.
Well, with infection rates beginning to plateau in parts of Europe, Italy is not the only country in the EU planning to ease restrictions. Denmark is reopening nurseries and primary schools next week. The Czech Republic plans to lift a ban on travel. And Austria, which has had 273 deaths linked to COVID-19, will allow small shops to reopen after Easter. Belgium and France and Spain are also looking at ways that they can begin to finally loosen controls on public life. Spain's Prime Minister says that the latest coronavirus data suggests that the country is close to the beginning of a decline in the epidemic. Pedro Sanchez told Parliament that the fire is starting to come under control. Well, with the number of daily coronavirus deaths slowing on Thursday after 2 days of increases. More than 15,000 people have died in Spain. The country has now more confirmed cases than any other in Europe. Well, here's Mr. Sanchez speaking in Parliament.
Si el ascenso ha sido duro,
if the ascent was hard, the descent will not be any easier, because it brings new dangers that we'll have to sort out. We'll need an adaptation process before coming back to normality, and we don't even know yet what kind of normality we'll be able to return to.
So that's a snapshot of the situation in Europe. Now to New Zealand, where the Prime Minister Jacinda Ardern has said that the country is turning a corner in its fight against coronavirus. New Zealand went into a severe lockdown just over 2 weeks ago, shutting schools and non-essential businesses, even before the first death was recorded. And now the curve is beginning to flatten, as you can see from this graph. This is from the news organisation Stuff, with a total of 1,200 cases and just 1 death overall. So that is good news, of course, but the co-leader of the country's Green Party and the government minister is warning that New Zealand really needs to stick to its strategy, not to abandon it halfway through. So let's talk to Dr. Kate Baddock, who is a GP and the chair of the New Zealand Medical Association. Thank you for your time. When it comes to New Zealand, we see witnessing such huge figures in the United States of deaths and confirmed cases in Europe. New Zealand, just 1 death. What is it that you're doing that you're getting it so right?
Look, I think that one of the things that we did right is that we watched other countries and we saw the very steep curves of increasing infections and increasing deaths. And we realized that we could not cope with that. And so as soon as we had community transmission confirmed, and I'm talking 2 people, when we had that confirmed, that's when we decided to go down to level 4 lockdown, which was a complete lockdown of every public gathering, schools, universities, all non-essential businesses. Everything got closed down as soon as we had community transmission confirmed.
So 1 death, 1,200, just over 1,200 cases. Of course, I need to stress that your population in New Zealand is 5 million people, so a much smaller population, islands, a little bit easier to contain. Do you think you've got a bit of luck on your side as well?
Look, I think that is true. It is easier as an island, but then again, we did have to bring about 40,000 New Zealanders home over the time of the initial phases of the lockdown. And we had something like 250,000 people in New Zealand who were travelling here at the same time. So yes, we're an island, yes, we can lock down our borders, but we still had to move people across those borders in order to get our own home and to get others back to their own countries.
And can you tell us, when it comes to per capita testing, how are you getting on there? Have you got quite a high testing ratio to the population?
Look, we have now. Initially, we were testing according to quite strict criteria, similar to other countries. So we were probably only picking up those who were in fact symptomatic. But as of day 8 of our lockdown, which we're now on day 15, day 16, we opened up testing enormously. So we were testing between 4,500 and 5,000 people a day. And that's how we really know that we are flattening the curve, because we only had 29 cases yesterday, despite 4,500, 5,000 tests being done.
And the idea, so you've been on a strict lockdown. When do you think you'll be at that position where you can revisit the notion of the lockdown easing, perhaps, in certain areas at least?
Well, believe me, everybody's looking forward to that. The government is going to be meeting on the 20th, with a view to making a decision about whether or not lockdown has to be extended past the 2-week period, which would be the 22nd.